Welcome back to Orientation to Clinical Research. We're going to talk now about statistical analysis, or how to analyze the data that came out of the studies that you designed in the last section. Now, when we talk about data, people tend to think data means numbers, and that certainly is part of it. Quantitative data is what we call the numerical side of the data. It may be numbers, it may be categories. It could also be what we call ordinal, which is categories that have an order to them, such as medium, large, small. There is an order to that, so they're not completely separate categories. Quantitative data are what you may be used to. But qualitative data are also quite common, especially if you're doing interviews or surveys that have open text answers, or if you're analyzing the literature, as in a literature review. With qualitative data, you're looking for things like sentiment. So, how do people feel? How do they express themselves about certain topics? You're looking for stories or quotes that relate to a topic. And then you're looking for themes. Themes are concepts that show up in multiple people's responses or multiple pieces of information, pieces of qualitative data that are consistent across a particular group. And themes are the equivalent of an overall picture of what's going on in a particular study. Now, process data are even less well known than qualitative data. Process data are things like your instructions or your methods. They could be an algorithm or a program. So process data are not really analyzed in the same way as quantitative and qualitative data. They're more described, but they are incredibly important for sharing how something is done, not just what the results of it are. Now, when we think about quantitative data, what we usually have is a dependent variable, aka the outcome, and independent variables, which are treatments or exposures. And our question really is generally, is the dependent variable associated with the independent variable? We may have other variables, sometimes called confounders, sometimes modifiers, depending on what they do, that would also be involved in the analysis. But the question at hand is really the association between the dependent and the independent variable. So if we're going to analyze quantitative data, the first thing we will do, always, the first thing you will do is descriptive. You will look at your data. You will visualize your data. You're going to make histograms and scatter plots and heat maps to understand what sort of structure does your data have. You're also going to describe it numerically. You're going to provide a mean or a median, a percent in particular categories. You may have a standard deviation or a range. You want to describe how the distribution of your data looks, potentially just by itself and potentially with regards to another variable. Then analytically, you are going to conduct what we call hypothesis testing. And if you remember back to our scientific method video, hypothesis testing is where we have two different hypotheses, each of which makes a prediction. The predictions do not mean the same thing. So in our case, we may have a null and an alternative hypothesis. The null says that the value is higher given the treatment, and the alternative says it's the same or lower. So that is two sets of predictions. So we take our observation and compare it to our predictions, and we say which one we would reject. The example I gave is what we call a one-sided test, in that we are only looking for if the treatment increased the value. A one-sided test is quite common in medical research because we are looking for improvement in clinical outcome, not just a change. But a two-sided test is also possible, and that is where you're simply asking, does the presence of a treatment change the value of the outcome? You may also be interested in what we call equivalence or superiority analyses. Equivalence says, is this value the same as the existing treatment? So, for instance, you have a cheaper formulation of a drug. You may do an equivalence testing to say, does the cheaper formulation provide the same result as the more expensive formulation? Or you may use what's called a superiority trial, where you say it can be the same or better. We just don't want it to be worse. So when you're designing your hypothesis test, you really have to ask yourself, what is the outcome that I am interested in? And am I interested in any change? Am I interested only in improvement? Or am I actually interested in seeing that it gives the same results? That will change your analysis. When you know what the hypothesis test you really want is, what is your research question? Take that to a statistical consultant and have them help you work out what is the best analysis possible. And trust me, statistical consultants are not asking you to come in and say what statistics you need. They're asking you to come in and say, what data do you have and what question do you have for it? So that's what you want to take to them. You may have heard of the concept of sample size calculations. Sample size calculations are used to determine the minimal sample you need. For analytical studies, you want to know the minimum sample you need to detect a significant and meaningful effect. So when you are deciding what sample size you need, you're going to be saying, what would be a clinically meaningful effect of my treatment? And how many samples would I need to detect that significantly? With a descriptive analysis, you are going to be looking for how many samples you need to estimate a value with reasonable precision. If you are looking to, say, estimate the prevalence of a particular disease in a population, you would want to know how many individuals in that population do you need to sample to estimate that prevalence, plus or minus a certain number of percentage points. That's your precision. With qualitative data, sample size calculations are much harder to do because what you're looking for is reaching saturation. And saturation is this concept that you are no longer hearing new information when you are reading or listening to interviews or comments. How many does it take to reach saturation is a much harder question than how many individuals do you need to sample for a significant effect? Because saturation depends on your sample and on the way that you ask questions. So that's something you really have to do in an ad hoc manner as you're going through your study. Qualitative data do get analyzed. Qualitative data aren't just things that you read and then say what quotes you like. When you are analyzing qualitative data, the first thing you have to do is listen. You have to read or listen multiple times until you feel comfortable with the information that is coming across. And then you can go through and code. And coding in qualitative data is attaching to individual quotes tags, what we call codes, that tell you that this quote is associated with this concept. Now, there's different ways to code. I'm simplifying this greatly, but two main ones that you may use are inductive coding, which is where you read and you listen and you come up with codes based on what you continually hear. So you see a repeated pattern and you say, that seems like it's a code, I should use that. Whereas a priori coding says, I have concepts that I am interested in ahead of time. And so I have these codes that I am going to look for in the data that I have. When you have your data coded, you're going to clump the codes into sub-themes and then overall themes. And themes are ways of summarizing the expressions of thoughts and opinions that are coming out of the data. Now, this is a very short introduction to the concept of qualitative data. If you are interested in qualitative data and in qualitative studies, I highly recommend you find yourself a social science collaborator who can help you greatly with this. As with surveys and questionnaires, it takes a lot more work than you think when you start out. That was your introduction to analysis. My biggest recommendation when it comes to analyzing your data, find yourself a collaborator or a consultant. I know that you are busy as clinicians. It's going to be hard to be on top of exactly what you need to do. Find at least somebody that you can bounce your analysis plan off of so that they can go through it and check to make sure that it's answering the question that you are trying to ask. These people are experts and they have the time and the expertise to make sure that you are saving your time and getting the most out of your research. Now we'll see you again in the next video to talk about what we do with our data.